Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department. I'm talking to Royce Smith. She's the coordinator of the Maternal and Child Health Program here at MCHD. Royce, how are you?
I am great. Thank you so much for having me.
Well, let's just get right on into it. You, like I mentioned, you are the coordinator of the Maternal and Child Health Program. We work here. We know what it is. So let's tell everybody that doesn't work here, they don't know what it is. Let's tell them what this program is and what it does.
Okay. So the maternal and child health program here at the Mobile County Health Department help assist women during the pregnancy, childbirth, and postpartum period. We also provide assistance to prenatal, well child care, infant and mortality prevention. We also deal with child screenings, child nutrition services, and several other different broad ranges of programs here at the Mobile County Health Department to make sure that our children are striving and surviving. Right now, with everything going on in the world, it's very important that we take time to make sure that our children are living the best life and the healthiest life that they possibly can.
That's right. And one thing that we are all aware of that childbirth did not stop during COVID.
That's
So,
true. That's true.
life does find a way, right? Dr. Ian Malcolm from Jurassic Park. So, yeah, some other things got shut down during COVID, right? But births never did. So the program is actually very vitally important because we're constantly getting information out there about it. More important so now than ever before. You're going to go into some statistics about that in just a minute, but what do you do as the coordinator of this program, and what have you done so far in this program?
So, as a program coordinator with the Mobile County Health Department over the Maternal and Child Health Program, I strive to increase parent knowledge, whether that may be, early childhood development techniques. It may be to help educate mothers on things such as safe sleep practices. I'm an advocate for breastfeeding and the benefits of breastfeeding for both mom and baby. I also go out into the community and participate in different outreach events and just making sure that I get information out there about our program. I recently was awarded the opportunity to go to Montgomery and attend the Strolling Thunder event with Alabama Partnership for Children. And during that event, I was able to go to the state capitol and I was able to meet and greet with Governor Kay Ivey, along with many other Alabama legislators. One of the other people that had the blessing of meeting was Miss Adeline Clark. She's actually a representative here in Mobile, Alabama. And just was able to speak with these people and just, embrace the fact that we're really working hard to make sure that our women and children throughout the state of Alabama are living their healthiest lives. And just was able to engage in that conversation and just meet these people. And I just really feel that we was able to get some good information out there, along with some positive resources for our up and coming generation.
That was a pretty clever name, huh? Strolling Thunder. all the baby strollers, obviously. So you talked a little bit about it, but talk a little bit more in detail about some of the services that the maternal and child health program offers.
Okay, so some of the services that we offer include parent education courses. So that may be safe sleep classes. We're currently working on trying to get some car seat safety classes. Hopefully that'll come later in the summer sometime, hopefully. We also provide information, as I stated previously, about breastfeeding and immunizations. We participate in group connect meetings where we reach out to different people within the community and different mothers in the community to try and engage with them and let them try to figure out exactly what they need and how we can help benefit the lives of mothers and children all over Mobile County. We also, like I said, we give them information about child screenings and immunization. Our biggest push, however, has been safe sleep classes. We want to make sure that we educate our parents and let them know that Alabama has one of the highest infant mortality rates in the country. So we want to make sure that we're getting the information out there to make sure that parents are making sure that their children are sleeping correctly. Everyone has the saying back to sleep, and that's exactly what it is. So we're just making sure that we're putting all the correct information out there so that different parents are able to take heed to the education and make sure that we're doing everything we can to protect our children.
And wow, how important is it now to advocate for breastfeeding? I mean, there's a nationwide shortage of formula on shelves and stores. So thank you for being an advocate for that, for sure. And you talked about it too just a moment ago. One thing I remember too from, the Safe Sleep program is the back to sleep, which is a thing for parents to remember in their heads. Put baby on their back in the crib to sleep. So it's really good education that sticks with you now, and I've kept that in my mind for quite a few years now. So that information is educational and it does stay with you. So you talked about some of the parts of the program. So who would be eligible, to participate in the program?
So right now, I primarily work with young mothers who are participants in our home visitation program that ranges from ages 10 to 19. However, we do accept referrals from community-based organizations, churches, schools, daycares, just pretty much anywhere where children are, primarily, and any women that may need some assistance to try and figure out how they can make sure that their babies are striving and surviving, especially with everything going on right now.
So you heard that, churches and daycares, you can contact Royce and she'd be glad to get you more information. Now you talked about it just a moment ago. You talked about the infant mortality rate. There's some pretty bad statistics that go with that. That's a very staggering fact that you have to deal with and research. But it's a public health issue. So tell me how maternal and child health fits in to public health.
Yes. So it's very, as I previously stated, the infant mortality rates in the state of Alabama are staggering. It's really sad, and I feel as though, when you know better, you do better. So that's why we take a really strong approach to making sure that everyone knows that, hey, this is an ongoing problem and it's closer to home than you think. So we try and make sure we get all the right information out there. And it's so important that we realize that it's a public health issue that needs to be looked at and taken about with very extreme caution, which is why we focus so much on our safe sleep classes, which is why we know that we have the ability to not only save our women, but also our children. It's not just, our babies are not surviving, but it's our mothers as well. So as long as we're putting the right information out there and we're letting these moms know that, hey, you have to take care of yourself as well as take care of your baby. So that's why it's maternal and infant child health. So we're making sure we're taking care of both within the community.
And that's important also too. There's a lot of research that goes into that case. Investigations also too, checking with hospitals and talking to the parents, and you're just trying to figure out the reasons why, and so we can work on those numbers to get those numbers down. So and it takes a special person to be able to do that. That's the tough part of the job. So thank you, certainly for taking on that part as well. So you talked about a bunch of the different parts of the programs, and there's so many benefits out there. But one thing we didn't mention was, how can people get in touch with you, Royce, to get more information about the program? So please share that with me.
Yes, so I can be reached via telephone. You can call me on my office phone. My number is 251-405-4526. If you cannot reach me via phone, you can reach me via email. My email is going to be rsmith, smith, @mchd.org. I absolutely love what I do. I love my job. I love helping people. So in any way that I can provide some assistance to try and make sure that our women and our children are thriving and surviving and everything going on, I will do my best to make sure that I can provide that information for you.
And I know you will. I certainly know you will. And thank you for being here. Thank you for being here on staff at MCHD. And I know you're going to make a difference. Like I said, you've only been here for a short while, but you're already starting to make a difference. And well, thank you also too for being on Wellness Wednesday and sharing the information about your program.
Thank you so much for having me. I look forward to seeing all the different things that we can work together on and just pursue and get this information out there.
Absolutely. It was my pleasure. Thank you again for being here.